Hi, this is a model of the larynx. The larynx is an important structure that protects the airway and allows for phonation or speech production. It is made up of several anatomical structures, including bone, cartilages, and muscles. In this diagram, we have an anterior and posterior view of the larynx. In red is the hyoid bone, which serves as an anchor to muscles that work with the larynx. In yellow is the epiglottis, which serves to protect the airway when pushed down by the tongue to cover the larynx during swallowing. In blue is the thyroid cartilage, which supports and protects the airway and vocal folds. Muscles work to elevate and depress the thyroid vertically during phonation. We then have the cricoid cartilage in green. It sits atop the trachea and serves as the base of the larynx and point of attachment for several muscles vital to phonation. In orange are the arytenoid cartilages, with the corniculate cartilages at the apex in purple. The arytenoids have two main processes known as the vocal and muscular processes. They can move in three different directions. They can rock, glide, and pivot. There are also several muscles that work together in the larynx to move the previously mentioned structures. If we look posteriorly at the larynx and focus on the cricoid and arytenoid cartilages, we will see the posterior cricoarytenoid, the transverse arytenoids, and the oblique arytenoids. The posterior cricoarytenoid are the only abductor or opener of the vocal folds. They do this by pulling back on the arytenoid cartilages. The transverse and oblique arytenoids are the main muscles of adduction, which is closing of the vocal folds, and function by pulling the arytenoid cartilages so that they come closer together. Next, you will see a lateral view of the cricoid and arytenoid cartilages, along with the posterior cricoarytenoid and lateral cricoarytenoid muscles. The lateral cricoarytenoid aids in adducting the vocal folds and increases medial compression of the vocal folds. This increases the fundamental frequency or rate of vibration of the vocal folds of speech. Jitter and shimmer are two terms that are used to describe the variability in fundamental frequency. Jitter refers simply to the variation of fundamental frequency, whereas shimmer refers to the same variation but related to intensity and amplitude of sound waves. If vocal jitter is greater than 1%, the voice will sound rough. Below, you'll see another lateral view, but this time we're looking at the thyroid and cricoid cartilages in the cricothyroid muscle. The cricothyroid has two parts, the pars recta, which does most of the work, and the pars oblique. Together, they cause changes in pitch by rocking the thyroid cartilage down closer to the cricoid cartilage, thereby tensing the vocal folds. Pitch increases as the vocal folds are made longer, thinner, and more tense, and pitch will decrease as they are made shorter, have higher mass, and relax. Medial compression, or adduction of the vocal folds when they come close together, is the primary process of pitch change, or changes in that fundamental frequency. The vocal folds are made up of two parts, the thyromuscularis and the thyrovocalis, which together form the thyroarytenoid muscle. The thyroid muscularis serves to relax the vocal folds, whereas the thyrovocalis tenses them. There are 5 layers of the vocal folds. The most superficial layer is called the squamous epithelium and serves to protect and hydrate the vocal folds. Next comes the basement membrane, which separates the squamous epithelium from the lamina propria. The lamina propria has 3 layers to it. The superficial lamina propria, which acts as a cushion for the vocal folds, the intermediate lamina propria, which adds elastic mechanical integrity to the vocal folds, and the deep lamina propria, which serves to add durability and support. The vocal folds vibrate in 2 phases, vertical and transverse. Vertically, the vocal folds open bottom to top, or inferior to superior. They close in that same direction. Transversely, the vocal folds open posterior to anterior, and they close anterior to posterior. This concludes my video. Thank you for watching.